Okay, we have a full agenda ahead of us, so we'll get started. Welcome and thank you for joining us here today for our webinar on community and intimate partner violence, building connections to disrupt and intervene. My name is Fatma Zara, and I'm from the National Network for Safe Communities, and I lead our work on intimate partner violence, and I'll also be facilitating today's conversation. October is Domestic Violence Awareness Month, and we recognize that it's an important and very busy time of year. There are a number of domestic violence awareness events taking place, and we know that you have a choice, an option to be attending many different things. So we're very appreciative that you've decided to come and join us today. Before we get started, just a few quick housekeeping items. This will be largely a panel discussion, but we will have time at the end for questions. You're welcome to place some of your questions in the chat box below. We will review these during the Q&A period, where you'll also have the opportunity to use the raise the hand feature on Zoom at that time. Also, today's session is being recorded and will be made available to all of you. I want to give a very big thank you to John Jay College's Center for Cybercrime Studies for helping with all the technology and support for this event, with a very special shout out to Chris Dolan. So thank you. Before I introduce our panelists, I want us to have some grounding and framing for today's conversation. We're really thrilled to have a diverse audience with us today from both the community violence and the intimate partner violence fields. On the screen right now, you'll see some terminology that will help familiarize you in our conversation today. Now, some of these terms may be familiar, while other terms may be new. We hope that these references can help serve as a guide in today's conversation. Some of you may have joined us at last year's webinar, where we had the opportunity to discuss how community violence and intimate partner violence intersect. And today's webinar really builds off of that conversation. Since last year, the National Network for Safe Communities has been able to do some strategic work in Allegheny County, Pennsylvania, to address this intersection of violence. For today's webinar, you'll get a chance to hear more about Allegheny County and also get a national perspective on how to bring together different partners to address this unique intersection of violence. Now, historically, the community violence and intimate partner violence field have existed in separate spaces, and both of these fields are doing incredible, important, life-saving work, but they're not necessarily working with each other, even though both forms of violence share common high-risk factors. Today, we're going to reiterate the need to cross-collaborate between both fields, how to build some of those relationships, and also identify the violence prevention benefits of doing so. So let me introduce you now to our incredible panel of experts. We have Alexis Acevedo. He is a doctoral candidate in the Criminal Justice Program at John Jay College of Criminal Justice. He is also a senior research advisor at the National Network for Safe Communities. As a researcher, Alexis has worked with several cities in the United States to understand how violence unfolds in local contexts. Through his doctoral work, through his doctoral work, Alex hopes. Oh, we'll just mute.
Yeah, sorry, I'm running into issues here. If you are finding that you are not unmuted, please do mute yourself just so we don't have too many disruptions, if that's all right.
Thank you, Chris. And let me redo Alexis's bio because it's important. Alexis Acevedo is a doctoral student in the Criminal Justice Program at John Jay College of Criminal Justice. He's also senior research advisor here at the National Network for Safe Communities. And as a researcher, Alexis has worked with several cities in the United States to understand how violence unfolds in local contexts. Through his doctoral work, Alexis hopes to understand the experiences of victim survivors within gender-based violence interventions. We're also lucky to have Catherine Collins here with us. She is the Chief Analytics Officer at Allegheny County's Department of Human Services. She manages a team of 40 analysts who use the county's nationally recognized integrated data warehouse to create research-informed policy, practice, and strategic initiatives in child welfare, behavioral health, homelessness, and criminal justice. Prior to coming to DHS, Katie Collins was responsible for managing the research and analytics within Allegheny County's criminal court. In this role, she worked to create a culture of data-driven decision-making in operation and planning. Katie received a PhD in public policy from University of Pittsburgh. We also have here with us today Sasha Cotton, who is the Executive Director of the National Network for Safe Communities. Before joining the National Network, Sasha led violence prevention work in Minneapolis for nearly a decade, including designing and serving as the first director of the Minneapolis Office of Violence Prevention in the Minneapolis Health Department. During her time as a Minneapolis OVP director, Executive Director Cotton oversaw the design and implementation of a comprehensive community violence intervention approach, which included the National Network for Safe Communities Group Violence Intervention Strategy. This also included work around a hospital-based violence intervention program and street outreach workers. During her tenure, Sasha has played a crucial role in the city as it faced the murder of George Floyd and the unrest that followed. Prior to serving as the OVP director, Sasha served as a National Resource Center coordinator at the Institute on Domestic Violence in the African American community, as well as serving in the Prevention Program Manager for the Violence Free Minnesota, the state's domestic violence coalition. She's currently representing Minnesota on the U.S. Commission on Civil Rights and is the Vice President of the African American Leadership Council in St. Paul. We're also lucky to have Reverend Cornell Jones, who is currently the Director of Street Outreach and also the GBI Coordinator for the City of Pittsburgh, where he brings outreach teams, social services, and law enforcement together to counteract and prevent violence in the community. Reverend Jones serves as a Protestant chaplain at STI Pittsburgh Prison for over 10 years. While working in the prison, he was also involved in many crisis de-escalation and gang prevention teams. He has over 7 years of experience working in juvenile detention centers. Reverend Jones is a certified crisis chaplain and a trained member of the National Organization of Victim Assistance, where he assists people who have been victims of large-scale crimes. He is also a certified gang specialist and co-founder of Operation Amani, which is a re-entry and street intervention program that focuses on people coming out of prison and people involved in street violence that are ready to change their life. And finally, we have Dr. Monique Williams, who is the Executive Director of Cure Violence Global. Dr. Williams is an accomplished public health professional, researcher, and practitioner specializing in violence prevention. As the Executive Director of Cure Violence Global, she spearheads the organization's significant growth and international expansion. In her previous role as the Director of the Louisville Mayor's Office for Safe and Healthy Neighborhoods, Dr. Williams spearheaded the development and implementation of the city's strategic plan to reduce violence, incorporating the Cure Violence approach. With extensive experience in academia, Dr. Williams has served as a community-based participatory researcher at both Texas A&M University and the University of Louisville. Her research focuses on improving health outcomes for marginalized populations through community health development, equity, and violence prevention strategies. During her tenure as director of the University of Louisville's National Center of Excellence in Youth Violence Prevention, one of the 5 centers designated by the CDC, she championed academic and community expertise to integrate practice, research, and teaching, advancing racial justice, health equity, and youth violence prevention in partnership with local communities. So very big thank you and welcome to our panel of experts that are here with us today. So let's jump right into our conversation and talk about why addressing this intersection of violence is so critical. Sasha, can I begin with you? Can you talk about your perspective from working both in the IPV and community violence fields?
Yes, thank you, Fatma, and good morning for those of you in the Central Time Zone. Good afternoon to those of you out east. Um, this issue is so near and dear to me and such an important part of the work and a really important way to lift up and celebrate Domestic Violence Awareness Month. So thank you all for being with us. What we know about violence truly is that it is a learned behavior. And so, whether or not you've been exposed to violence through seeing domestic violence or community violence, that exposure is likely what's influencing your likelihood to use violence. And I think sometimes we are remiss in segmenting violence into these buckets. And while how we solve that issue and work with folks to address it requires nuance, the real issue is that people are hurt by violence and we can learn from one another through practice and through experience to come up with solutions that really meet the needs of the individuals that we're working with. The other reality that I think so often we fail to realize sometimes as practitioners and certainly as policymakers and researchers can be that people don't experience these things in isolation. There's a real intersectionality in the ways that people experience violence and the ways that people use violence. And so the more integrative we can be in our approach, particularly as we think about marginalized communities, I think the better we can serve folks and the better we can develop things that will actually work both to reduce violence and preserve people's humanity. So I'm really excited for this conversation and looking forward to working with all of you soon.
Thanks, Sasha. Dr. Williams, can you speak from both your national and global lens on why it's important for the community violence field to also consider intimate partner violence dynamics?
Sure. So, I mean, for any of us who work in the community violence intervention space, right, like you quickly realize that violence doesn't respect the boxes we draw around it. The same person who may have, witnessed gunfire on their block may go home to a partner who's afraid of their temper. We know that harm travels, right? And so it seeps through our homes, our relationships, and our neighborhoods. And most of you know that us at Cure Violence, right, we view violence as a contagion, right? And when you understand the science of contagion, you know that you can't cure the epidemic in one sector of the body and ignore it in the other. And so if a community is experiencing shootings and retaliations and also high rates of intimate partner harm, those are co-occurring outbreaks that share drivers, right? You're talking about trauma, power, inequity, disconnection, and right, the learned norms about control and masculinity. And so we do see this globally. If I think about our Latin American partners in the work that we do there, particularly in Honduras, our latest evaluation that we had in like 2021, we saw violence interrupters there interrupt almost 18,000 violent incidents, but 65% of those were femicides averted. And so we learned quickly that we couldn't just reduce community shootings and homicides without confronting the gender-based side of things, because they had similar roots and they were happening at the same time. So this intersection matters because it's the same kind of public health epidemic manifesting in different rooms of the same house a lot of times. And so if we're talking about true community healing, we can't, like Sasha mentioned, right? Like there are nuances to the differences, but we also have to investigate and interrogate the intersections and the shared risks that exist across both.
Thank you so much, Dr. Williams, for that framing. Um, I'm wondering, Alexis, can you walk us through on what research actually exists talking about these two forms of violence converging? Can you walk us through that?
Yes, I can. Can everyone see that screen? Great.
Yes.
So let's dive into some of the research. Let's begin with some of the shared causes of violence. Research suggests that community violence and IPV share many of the same risk factors, including conflicts within the family, associating with delinquent friends, and lacking the skills to cope with problems, right? These risk factors range from the individual level all the way up to the societal level. We also know that engaging in one form of violence increases the odds of engaging in other forms of violence, right? This has been shared previously by the panelists here. A key point in the overlap between community violence and IPV is that the relationship itself can represent a cause. We know that there is an increased risk for dating and relationship abuse that can be tied back to the social structure of groups and gangs, their rigid gender roles, and the backgrounds of many of the individuals within the groups and those who associate with them, right? Lastly, there's a difference in age between the difference in age between individuals can also be a cause for concern, as female members in age disparate relationships are more likely to experience IPV, while male members in age disparate relationships are more likely to perpetuate IPV. So while CV and IPV represent different forms of violence, they share many of the same origins. Next, let's look at, because this is a relatively new research focus area, we can look to related literature for some insight, right? So let's look at the literature on offending typologies within criminal justice. We know that individuals who engage in partner abuse also engage in violence against others. This body of literature also tells us that gang or group members and affiliates have a broader range of victims, including intimate partners, compared to generally violent men. They are also more likely to carry weapons and be worried about victims of violence themselves or become violent when angry. The literature also suggests that generally violent men are more responsive to conventional treatment compared to family-only violent men. However, there is also literature that suggests the opposite. So broadly, we know that there are differences in treatment recidivism. This is a key point because while CV and IPV may have shared origins, how we choose to address the overlap may have to look different from traditional responses. So as we begin to understand and study this overlap, we should think about related literatures and what they can teach us. Next, let's look at research on the overlap between CV and IPV from Chicago. Research on the connection between IPV and CV revealed important red flag relationship factors, such as a person is involved who is in a position of influence in any form of group, a relationship that involves a current or former partner involved in groups or gangs, and a relationship where IPV is present or threatened. A broader analysis that reviewed 1,943 conflicts mediated by ceasefire in Chicago from 2000 to 2015 found that around 7% of conflicts were domestic in nature. And of these 7% of conflicts, 55% of those involved intimate partners, right? So one of the patterns that this body of literature suggests is that DV, and more specifically IPV, often spurs on community violence. And lastly, in our work at NNSC on NNSC on community violence, we perform an exercise that we call a problem analysis, where we review homicides and non-fatal shootings in cities that we work in and produce a report. So what we wanted to understand was how IPV shows up in those homicides and non-fatal shootings across the country in the sites that we work in. Based on work from 42 sites across the country, we know that IPV-related incidents make up an average of 9% of all incidents. Related referring to those that involve our current or former intimate partners, as well as those that involve a third-party individual, such as a new boyfriend or girlfriend. IPV-related incidents make up 25% of all non-GMI incidents or incidents that do not involve any group members. IPV incidents make up an average of 5% of all group-involved incidents. We refer to these as GMI or group member-involved incidents. And the most striking finding is that while IPV-related incidents make up a small part of group-involved incidents, group members were involved in an average of 1 in 4 IPV-related incidents. So this suggests that even at the most serious forms of violence, there is a good deal of overlap. So taken together, while this remains a relatively new area of focus, there is really good research that can act as a foundation for future research and also for future practice.
Thank you, Alexis. That's incredibly informative. And I'm wondering now if our Allegheny partners could talk a little bit about why has this been such a priority for Allegheny County to look at this crossover of violence? Katie, could you potentially start first and touch upon why this was important for larger systems in Allegheny and for IPV partners?
Yeah, thank you. And I think I'll start by saying, everything everyone else is saying, we see reflected in our community, and it really is the kind of the reason that we were interested in looking at this intersection, because when we center people and neighborhoods and communities in here in Allegheny County, we see that people are impacted by all of these forms of violence, particularly our more vulnerable communities and families. So. For example, in our child welfare system, 1 in 3 of individuals coming in are also have IPV and intimate partner violence as a risk factor. We see a full 80% of those cases in that system that have experienced IPV in their histories. And so we see this huge overlap in our systems. And then we also see in our communities really disproportionate impact of violence and people that are experiencing violence. And so by looking at where we're seeing high rates of intimate partner violence, though it's prevalent throughout our county. There are communities that it has higher prevalence, and those overlap pretty one-to-one with the areas that we're seeing real high rates of community violence. And so kind of targeting in on certain communities. And we also see disproportionate impacts on certain parts of our community. So really for victims of homicide on both sides are disproportionately our Black community members that are impacted. And so we start to see this overlap of who's impacted. And I think when we kind of dig in, we're starting to see too, when we're actually looking at incidents that are, violent incidents, we see this overlap in more case conferencing, where we see that though it might be community violence, the underlying factors are related to interpersonal and intimate partner reasons, and they're underpinning a lot of the conflict that we're seeing in our communities. And so when we start to think about how do we create a community, how do we create a place where anyone in our community can experience a life without violence, we can't address just one without kind of thinking about how do we address all three or all types of violence, because we don't want a place where we want to stop community violence, but then if that violence then continues in the home, then that continues to perpetuate future violence in all of its forms. So that's kind of everything that everyone is saying is also what we're seeing here and why we embarked on this work.
Thank you. And Reverend Jones, you have this important on the ground daily perspective with the work you do within communities to disrupt community violence. Why has this been important for you and your team to become more familiar with intimate partner violence?
So, thank you for bringing the conversation to us, because when you guys all brought that conversation to us, I don't know if you remember, but we're like, this is the answer to prayer, because this is something that we're dealing with on a regular basis. And with, even thinking of the concept of dealing with the disease of violence, we do a lot of research. We do a lot of dealing with the streets and trying to find out where the situation came from. You know what I'm talking about? Like, we know there's a homicide that happened there, or there was a shooting that happened there, or even a big fight that happened. So we try and track who do we need to get with and all those type of situations. And then through those, we're seeing on a regular basis that these are domestic violence situations, intimate partner situations. And so this became extremely important to us, because if we're trying to stop the impact of violence in this situations in the streets in our communities and in people's lives, like, it's important to know where things are at. So, through time, we used to try and stay away from, domestic situations. That was the thing, like stay away from it. But, with everything such as social media, just as an example, we have a website here that I go to probably about 3-4 times a week where all they do is track fights from the clubs. And from those situations, I could use, if we don't get with most of those situations, we're able to, a lot of those are coming from domestic intimate partner situations where they out there, someone sees someone else that they're with or what all and whatnot. But if we don't get to those situations, what we found is if we don't interrupt the disease at that moment, with that, it's going to be a shooting. It's going to be homicide. So we had no choice but to get involved with that. That's why the power of social media took that to a whole nother level. It took, fights to a whole nother level. It used to be all of our situations were tied into more drugs. You know what I mean? But now it's like drugs, and then you got the domestic situation that happened, and people weren't talking about it. Now we're at a point now where we have no choice but to talk about that situation, or we're going to continue to see people getting shot and people dying, to the point where the Pittsburgh police actually ended up having to develop a department that focuses on domestic violence. So like the level of communication is important because we're seeing that there's a lot of get back. There's a lot of people, for example, if someone got beat up and it was domestic violence intimate partner situation, now we got to think of, all right, who's that person connected to? Because now that's going to be the next person that's going to try and deal with the situation. Now my violence interrupters now need to get with that brother or that sister or that person like that, while we're connecting that victim to resources from DHS to Women's Center and Shelter, Center for Victims, and all that type of stuff, to be able to have these conversations, to be able to counteract things that are going on, while we're making sure that the next level of what could actually happen isn't happening, even to the point where we're pulling levers. I'm blessed because I was the pastor down in the penitentiary for years. I'm able to find out, all right, who's on probation, from the situation like that. Now I'm calling that person in, and like before they do something and able to do it's a semi-custom. Don't get on me too bad, Sasha. It's a semi-custom notification where I'm pulling them in, dealing with probation or parole, and being able to say, hey, listen, nobody's here because you did anything wrong. In fact, I want to give you the support so that you don't do anything wrong, because of what the streets are saying could possibly happen. We want to give you the support while we're giving your family member that support, so that they're able to get get what they need to be able to be supportive in this domestic situation that is going on. So we're dealing with the families and all those type of situations. And we found out that if you're going to be effective in violence intervention, you can't forget about this part right now. You can't forget about this part, because this plus this can equal a homicide or a shooting. So we're just trying to counteract a lot of things that could really happen in our communities.
Thank you, Reverend Jones. I think you and all the panelists have really made such a strong argument of the need to address this intersection. But I think there's also historically been a precedent where, these two fields don't necessarily haven't necessarily collaborated with each other. So I'm just curious to know, Dr. Williams and Sasha, could you see what you share what you see throughout the country? Why has it taken so much time for these two fields that need to work with each other? They haven't. Why hasn't that happened?
I'll take a run at it, and then I'll invite my sister to join in this answer. I think the approach to the work has been seen as separate because who's getting the services is really different. And I think even when we think about who provides the services, it's important to remember that in domestic violence services, for the most part, it is women who are providing the services and who are receiving the services. And in CVI, it is men who are receiving the services and men who are delivering the services. And so while that sounds really rudimentary and like it shouldn't be a big deal, it really does play out in how and who and what we do. And so I think that has a huge influence. I also think that most of the time we think about services in domestic violence, we're talking about victim orientation. So we're talking about a person who has been injured by violence. And when we think about community violence intervention or community violence generally in services, we know that a lot of what we're trying to do is prevent the next act of violence. And that can be seen through the lens of, perpetration. We don't always get to the granular fact that most people who perpetrate harm have also been harmed themselves. And so there's this interconnectedness. of perpetration and victimization on both sides, but certainly when we think about CBI. And so I think all of that rolls out in a way that makes the interconnectedness of this work not always feel obvious. I think for those of us who do it, when you talk about it, a light comes on where all of a sudden you're like, of course, right? Of course, I, as a domestic violence advocate, am dealing with someone who has a partner who's also on probation or is also violent in the community, and vice versa. So I think for practitioners, this all makes a lot of sense, but the field has not quite figured out how to talk to each other. And so we think we've stumbled onto some solutions that are helping to bridge that gap. And so I'll kick it over to Dr. Williams for her take on this.
Yeah, so what she said. I mean, I think, right, like just historically, right, like the fields were, you're talking about violence, but then they were still like birthed from different places, as she mentioned, right? And so it's like different houses, different languages. And, you know, the IPV field, you know, it evolved from the women's movement and advocacy for survivor safety, which is often led by, you know, like your social workers or, you know, legal advocates. And then you had the CBI field that grew from, you know, street level outreach, the public health approach, and you have workers mediating, you know, conflicts and shootings. And right, like she mentioned, both are responding to an urgent crisis, but even like the systems that fund and govern them, they're just different, right? You're talking about different funding structures, different metrics, different professional cultures as well, which are necessary for what they're both addressing. And then for those of us who think about it too, though, there's also fear, right? There's fear that bringing interrupters or outreach workers into an IPV space could compromise survivor safety. And then there's fear that, you know, the IPV's fields kind of systems-based structure could potentially dilute the credibility of grassroots street practitioners. So I think the result has just been like parallel systems that like kind of rarely talk, but you know, as has been explained, a lot of the people that we serve overlap. And then kind of more broadly, ideologically, patriarchy sits at the center of this divide. You know, in the US, our culture has normalized power imbalance in both public and private spaces. So even in well-meaning systems, we replicate those hierarchies. You know, I do find it fascinating that in places like Honduras and Colombia, societies that are known to be kind of more patriarchal than we are, they have like accepted these intersectional strategies faster than we have, because I think they're desperate for survival, and kind of open to innovative ways to save lives. And so they've seen violence interrupters save women, and that has shifted belief faster than any ideology could, I think. But you know, we're here, the US is catching up. I think Allegheny County is a powerful example of what can happen when those silos fall. With, you know, being able to bring everybody to the table and kind of proving that it can be done.
Thank you. And let's, you know, turn to Allegheny County. Katie, Reverend Jones, what do you think have been the previous barriers or missed opportunities to do this collaborative work in Allegheny?
I mean, I'll start and then I won't take very much because I think that what Sasha and Dr. Williams are saying is exactly what we've seen here, is that you know, it's a huge gender divide, a huge kind of systems community gap that we've seen. Funding is different. Really, yeah, who they're serving, who they're working with, all of those things have been huge barriers in the past for kind of bridging this, where they're not even at the same table. And then there's this distrust that kind of existed before we brought everyone to the table. So I'll stop there because I think that Sasha and Dr. Williams covered it well, and I think that's exactly what we see here. But I'll let Cornell add.
Yeah, I mean, it's been covered really. It's, you know, I think in a lot of ways we were afraid to even deal with it because it's that mindset of, well, you know, they'll be back tomorrow. You know what I mean? You put all this work in to it, and they'll be back tomorrow. That was the mindset. I think that was good. Why it was really good to get that training from you all too. Because the other thing is, I'm blessed to be able to be working with some amazing geniuses that have backgrounds. You know what I mean? And so I never want to put them in situations that are going to get them jammed up. And so I got to be very strategic in what situations that they're being put in. And a lot of times, that person, the spouse or whoever, you know what I mean, is an aggressor and comes back with some stuff with that. So I gotta, as much as I try and protect my team as much as possible, and those are situations. And like the funding piece is huge. And you know what? And it's a shame to say it, but I feel like in today's culture, it's almost accepted to a point. You know what I mean? It's almost accepted. I'm talking about music wise. It's the note, like, I was talking to somebody earlier today, and they were talking about how a lot of these intimate partner situations are becoming younger and younger. You know what I mean? They're becoming younger and younger, and being thrown in music. You know what I mean? Things like that. So when those things are strategically happening, I feel like, like we get numb to it, but we can't afford to be numb to it, because we have to re-educate and we have to inform people. And with those things that are just, oh, this has happened. It's happened to my grandma. It's happened to my grandma's grandma. That's how, like, we got to break cycles of things that are going on. And there was one of the communities that we were dealing with a lot of domestic situations, intimate partner situations. I'm not going to name the community. I worked with one of the nonprofit organizations, and we did some trainings. We set up trainings and we put it out there. We had some of the, what we believe are credible messengers, people sort of go out there and talk to the people and let them know what's going on. And what we also found was a lot of people were afraid to come out to the sessions. So there's a lot of, fear that's out there. I mean, like, I think we have to be very strategic on how we're, getting the information out to the people, because, we want the people to be empowered and we want the people to be safe, because we go back to where we go, and we got to make sure that their situation is extremely safe. So there's a lot with that. And I think that's the situation that it's almost like that cousin that we don't deal with, you know what I mean? That we don't deal with in the family, that we're like, they've been locked out. I'm just using that example. But that cousin, and we got some of us that know what I'm talking about. Some of the people, you know what I mean? But that's the situation that we got to give that cousin every resource that we can, because if right, that cousin needs everything they need to be able to do better in life, period. So we can't let that be a secret anymore. We got to put that on Front Street.
Thank you. And maybe this is a good place to drill into how did you bring these diverse partners together? Like, what did Allegheny do to get everyone in the same space?
Yeah, I mean, I think that we wanted to start with just bringing everyone to the same space. I mean, I think both Department of Human Services is helping to coordinate a bunch of this work on both sides. So had already kind of established those relationships, so could bring people to the table. So it was good to have like a common entity that was trusted on both sides to bring people to the table. But I think the first step was really for us, kind of creating some common language, just sharing on either side. Like, this is what community violence intervention looks like to our IPV providers and vice versa, because there just wasn't even kind of that common, or we couldn't assume that there was the common baseline understanding of what was happening in these fields. And so that was like our first step. And then really expanded out to have some conversations with leadership to really talk about this intersection and get people's perspective about, similar to this, but with everybody in the room saying, what are you seeing? What are you hearing? What are the needs that we're seeing? And providing to starting the relationship introductions. Here's what our victim services providers look like. Here's people that you might reach out to if you have conversations, if you want help. And then doing another step down and really going to folks that are working on the streets in violence interruption, and having that same kind of conversation in a more in-depth level, really thinking about, I think we focused it a lot on like listening sessions, like what are you seeing? And also, we don't want you to do more. I think what we see and what we heard is like, we do want to specialize. This is our job, is to do community violence interruptions. We're not experts in IPV, and we don't also want to put ourselves in unsafe situations. So we hear it and want to say, okay, we hear you. We don't want to delude how we're working in either of these spaces, but we know people are encountering this. So what kinds of tools and resources can we start to provide as like a first step? So that's like a lot of what we did was really conversations, listening sessions, trying to provide resources and create relationships as a way to start to build the groundwork here.
Yeah, and I think, because we actually have some reviews where we're going through shooting reviews and things such as that together. I think those relationships are extremely important. So when this was brought to us, we're able to relate how we were able to add more resources to, and could possibly even stop some of the situations that we're talking about through our reviews and things such as that. So this was, as my wife would say, this is another tool to our toolkit that we were able to utilize that will help in situations. I think the biggest fear was, the teams were, and I'm saying the teams because all of the teams that were there were like, listen, man, I ain't get myself in a situation where I'm gonna get shot at and things like that. So that was something that was laid out in the beginning to be able to know, for them to be able to know that there's safety involved in this right here, and to be able to talk through some situations because that's important. That's extremely important. And this is like, this is not we don't know this field but so much. But to be able to have DHS, to be able to have Allegheny County, and to be able to tap into the resources that you all are sharing has been good because now we have a team that we could go through for this situation because it's every week. Like I said, I've mentioned it before, social media wise, they're showing the biggest fights. They're showing, the young people that we're working with when they're going to, when they're going and it's showtime, the cameras are on, they're going live and all that type of stuff. And the majority of those situations are tied to a relationship. You know what I mean? So we're finding out what's going on with those situations, finding out who beat up who and all that type of stuff. And then we deal with those situations. So you can't, these resources are showing us that you can't do violence prevention or intervention nowadays without tapping into this.
Thank you, Reverend Jones. I'd love to hear from you and Katie of what have been the initial benefits you're seeing, because these are initial conversations and trainings that have been taking place. How has this benefited violence intervention and prevention so far in Allegheny?
I can start too. I think outside of all the stuff that Cornell was talking about around just like the relationships and resources, which are really incredibly helpful, I think both having additional diverse voices at the table to talk about what they're seeing on the ground is really important. I think a lot of the times when we're thinking about, at least in the IPV space, about what, or in any of them, what will work, we kind of miss of what the dynamics of what's going on. So getting those voices in and helping to co-design what might work has been really helpful. I think having credible messengers in communities being able to understand and start to speak around intimate partner violence is like a real benefit and potential here, because so much of here and everywhere of IPV is not reported to formal systems. And so a lot of the violence that's happening in the communities are things that would never come to the police or never come to victim services. And so being able to kind of have folks be able to credibly messenger that violence, and this all forms of violence are things that we don't want to tolerate in our communities, is something that is really the potential, I think, in this space, this overlap that we're seeing. So I'll stop there and let Cornell jump in.
No, you 100%. That credible messenger piece is huge. I'm not saying that the outreach workers are going there and lecturing them and all that type of stuff, but just the simple words of, bro, you hot. I'm hearing your name too much. You know what I mean? Like, what do we need to do to help keep you, get you together? Because I'm hearing your name too much in multiple, conversations that we're having. You know what I mean? And so those little, nobody ever wants to be hot. You know what I mean? So, but I think the thing is, I'm not just saying that I'm hot, but you're hot, but we also have resources now. It's just that we're not just telling you like we're like, all right, how can we help you to connect with, so even the people who deal with workforce development from the team or things like that, to be able to, we need to find you a hobby. What do we need to do? Like, you know what I mean? How can we redirect, you from doing this type of stuff? So, and how can we get you some anger management, all that type of stuff? So the credible messengers are key because they're respected. A lot of times these are, they're former coaches, they're former mentors, stuff like that. So they're very, those are key people who, it's not coming from a law enforcement level, it's coming from someone who's not law enforcement. And so they'll grab onto it. They know that if their voice is that hot right now, there's a possibility of law enforcement stepping in that type of situation. But that credible messenger is the one who's, I'm coming to you right now because, we're just trying to stop anything from jumping off, but I need you to fall back from what you're doing.
If I can just add, I think what Reverend Jones just laid out is such an important piece to highlight, is that the relationship between credible messengers and the people that they work with is so in-depth and can be so unique, and the kind of influence that they can have over the changes that people want to make or are inspired to make are vast and wide. And so this idea of giving them more language, more tools in their toolbox to talk about not just community violence, but also the relationship dynamics and the relationship violence that they might be having in their homes, is really just an added benefit. I think it's so important to contextualize that what we're trying to build here is just that. It's skill building. So much of what we see in the community violence space is wanting to give credible messengers, support and outreach folks, violence interrupters, tools and resources to refer their clients to help them build themselves up so that violence seems less likely to be the way to solve their problems. And if we do all of those things around community violence, but we neglect to help them build the skills around intimate partner violence, we're just redirecting them instead of actually solving the problem. And so I think this is just a really important thing to be building on.
Thank you for uplifting that, Sasha. I think that's absolutely key. And I think, when working with Allegheny County initially, the purpose of addressing this intersection of violence is to enhance safety, right? That's the overarching goal, to enhance safety. It's the heart of the work that, everyone in Allegheny County does and everyone throughout the world does in addressing either intimate partner violence or community violence. What's being built in Allegheny County is focused on how we message and intervene with individuals who are causing the IPV harm. And in many ways, this is non-traditional IPV work, right? And, this messaging is centered on the people causing harm. But Katie, I'd love for you to touch upon, why do you think this still increases the safety of the victim survivor?
Mm-hmm. Yeah, and I think it is a huge kind of cultural change here, to focus on the person who's causing harm. And I think that even just that focus has really helped improve victim safety, in that when we think about the person that needs to change or needs to do something, it's on the person that's using violence, not the victim. So we're not asking the victim to do anything else, or the victim survivor. It's not. It's saying, actually, as a community, we don't want violence to continue. We want violence to stop. And as a community, we're gonna figure out the ways in which we can do that. It's not, the onus is not only on the victim survivor. And so we are kind of wrapping ourselves around that person by focusing on the person using violence. And I think that really thinking about that, by focusing on the person using violence and providing resources, it's not a lack of accountability for that individual. In fact, we're saying no, violence is not something that will be tolerated, but we also want to stop this violence. What can we do to pause and stop this violence? These individuals here and everywhere, I think, are individuals that live in our communities. They're co-parents. They're people that are going to continue to be in our communities, in our families. And so ways that we can actually stop the violence, and the focus there is only going to improve victim safety. And then I also think having the voice of the victim survivor at the table to say what would help them improve their safety. So the onus isn't on them, but their voice is heard in the whole process of how we're addressing things. And often things that they would, particularly at like individual level, things that they might bring up are interventions that would work. So they have ideas too that are really front and foremost, and we want to make sure that that's centered, but it's not the only thing. So I think the whole approach really make sure that we maintain victim safety, but kind of removes the onus of them being the only person that has to do something.
And Reverend Jones and Sasha, maybe you can speak to how there are benefits for the safety of the person that's using IPV harm. What does it mean for everyone to come together, and how does it keep that person safe, but also get them connected to services.
Yeah, I'm happy to jump in and then we'll pass it to Reverend Jones. You know, I think for far too long, when we think about intimate partner violence, we've thought purely about victim services, which is such an important part of making sure that we do that. It's critical. But we can't just say to women, don't get hit. We have to say to people who cause harm, don't hit people, right? And I think on the CVI side, we've been saying that, right? But we haven't always taken that approach when we thought about intimate partner violence. And there's cultural reasons for that. You know, there's policy and political reasons, but I think this does really give us an opportunity to pivot and think about how we change the way we're looking at this so that we get to solutions that actually apply on both sides and not just blame victims or think that we can punish our way out of this. Most violence is relational, right? And so if we don't, I mean, whether it's retaliatory violence in community or relationship violence, when we're talking about IPV, there is this relationship at play. And so often the cure is not incarceration, right? That's not to say that people don't need to be held accountable and that when laws are broken, you know, there's a course of action that happens. But as someone who's experienced violence, as someone who's worked in this space for a long time, I think very few people feel like their problem is solved by the person who caused them harm being incarcerated. It just does, it's not the solution we often think that it will be. So I think these innovations, what people want to know is that the harm is going to stop, that the likelihood that that person will come back and have a vendetta or retaliate is going to be reduced, that they are safe, right? Like that's what victims of intimate partner violence and community violence want, is to feel like they can move forward with their lives and feel safe. And so I think the coaching and the work and the building that Reverend Jones and you know Dr. Collins are doing in Allegheny is really about building out things on both sides of the equation, people who have been victimized, people who have been causing that victimization, and saying, what do we have to do to stop the violence? Because I can put you in jail temporarily, that's not going to mean that when you come home you're not violent. How do we solve this comprehensively? And I think building people up is really the solution that we're arriving at, and that's what makes all of this so exciting. So I will yield there.
No, that's very good stuff too. Two things that I'm blessed because I used to work for a victims organization too. So I think that I'm able to. I've seen both sides, and I've worked in corrections for a long time too. So in a lot of my counseling through the years, I also saw that a lot of things that people were doing were that they ended up going to jail for were things that were done to them. I think that was somebody mentioned that earlier. Like I saw that a lot. So like the level of trauma that people are dealing with when you're not dealing with your trauma, like it builds up. You know what I mean? It builds up, and you get in a lot of type of situations that you hear these because you end up hearing these words. You have the right to remain silent. You know what I mean? Because of the buildup of, I always say it's like that pop can of shaking up. You know what I mean? Like that person. This is my opinion. That person's still a good person who made a bad decision because of a lot of trauma that they've experienced and all that type of stuff. So I'm also a believer that getting that person support, not just, that's the good thing about having credible messengers, and that's the good thing about tapping into the community, but having somebody that could actually walk to a support group with you, saying, you know what I mean? Like you saying, oh, G's coming with me to the support group, you know what I mean? And they're able to share how they used to be, how they used to, were abusive in their situations and those type of things. Like being able to get caught up in a situation where you're able to get some type of support is extremely important to me right now, because I realize like I don't throw anybody away. My thing is everybody, like I believe everybody has a chance. Like, if that was the case, like I wouldn't be doing what I'm doing right now. I'm just being honest with you. Like, so like being able to get those number one, of course, we're always going to make sure that we're giving the support to the victim, but I also want to make sure that that person, if the offender, if they still have breath in their body, let's find a way to be, even if you're incarcerated at the time, let's find a way. I got a reentry program because I saw the genius that are in people who've been coming out of jail, because I'm like, how can we counteract this type of stuff, because you still have purpose. So being able to find that resource or find that person that could walk with them to be able to support them through their process so that they could go to their group, so they could find out what it actually looks like to be able to be in a healthy relationship. You know what I mean? I got a friend of mine who's in an abusive, well, was an abusive relationship. I said, well, did they ever see a positive relationship? And they were like, no. You know what I mean? Like, how could we show them what this looks like? And how could we show them this isn't what the fairy tale? And there are arguments, but there's ways to not disrespect each other and things like that. So how do we bring it? And this isn't just us, as you know, this is my whole thing is we bring in the whole village. When we bring in the community, we bring in the elders and people like that to be able to show how could we love on the people where they're at and do what I call Planet Fitness, a no judgment zone, but we help them right where they're at in those type of situations. So that's important to me, because we can't give up on people, but understanding that there's programs, there's resources, and tapping into those ones that are effective, not the ones who are just going to get money, but the ones that are effective, that are showing the fruits, that are connected. Where if I know I'm handing off Ray to a program, I know that I'm still going to check up on Ray, but I'm giving them to a program that is serious about what they're doing. They're not going to just write down a number saying that they got this person, but they're going to make sure that we're keeping up. They're going to get the resources. They're going to get the wraparound service that they need to be successful.
That is incredible. That is fantastic. And I want to give a chance for Dr. Williams to also jump in on this piece before we go to our question and answer period. We also have to think about the safety of violence interrupters, support and outreach workers that are, messaging for the first time about intimate partner violence. How do we consider their safety in all of this as well?
Yeah, so very important, and the thing that they're also concerned about too. So I think when you think about safety for frontline workers, it always starts with structure, right? Like our people are often first responders to very volatile, emotionally charged crises. So they're used to it. But when we step into kind of IPV related harm, the risk multiplies because the violence is intimate. And for those of you who work in the space, it's really unpredictable. And so, we train workers to kind of treat these moments, again, like infectious disease exposure, right? You assess the risk, create distance if you need to, call for backup, and use relational de-escalation methods, not confrontation. And so, right, like there in Allegheny County, the interrupters link with the high-risk IPV team, and they receive intelligence from the probation or victim advocates before making contact. And so that kind of coordination saves lives. I think on even the international kind of platform in Latin America, we have less kind of formal processes, but we have trained kind of rapid response teams, and they go out in teams of 3 or 4. And they're always backed by a network of safe houses, right? And so, but just as important as physical safety, there's the emotional safety piece in all of this. And so we know that this work is trauma on top of trauma. And so, you want to work to protect your frontline workers by normalizing mental health debriefs, mental health supports, and really like building that peer support culture of everybody being able to like talk and process, what they may have just run into or heard about or experienced, right? And so, this work is very, very sacred. And so, the sacred work requires a level of protection.
This is about interconnected safety, right? It's not just the victim survivor. It's not the person who's using harm. It's those that are working on the issues. It's the entire community. Thank you all for sharing this. And it makes me think about, we can learn a lot from the domestic violence field. There's safety planning that happens in the domestic violence field where, the victim survivor is given different tools and ideas of how to enhance their safety and think about it. But the burden still falls on them to do that. The National Network has been working on getting some inspiration from the DV field in regards to safety planning and how we can do that for community violence clients. We want to make sure community violence clients are not only getting supports they need if they're at risk of being victimized, but also to reduce their risk of using harm as well. And part of the messaging around community violence safety planning is also don't use intimate partner violence as well. This is an opportunity for us to see this work as holistic and interconnected. If you're messaging on one aspect of safety, why not easily layer in these other pieces? Because as we know from Alexis's research and what all the panelists have shared today, it's all interconnected and we have to use these different opportunities to message. So I want to open it up now for questions and answers. Chris, were there any questions in the chat box? If not, we can have folks use the raise the hand feature to ask questions.